Bakker, naturopath. Thanks for coming back, checking out my channel. Here's a question I got from a subscriber. I was wondering if you could get pain and mild sepsis symptoms from leaky gut syndrome. I've had pain, and which I thought was my liver, and a toxicity feeling. All my hard tissues are fine, so I'm seeing a gastroenterologist next week. Thank you so much. Well, you can get a toxicity feeling and sort of like mild infection kind of feeling and flu-y from many different types of conditions. It's certainly worth going to see the gastroenterologist to get checked right out properly. If you still have pain and issues after that, and you've been to the gastro doctor, and if it comes back as NAD, no abnormal diagnosis, then I'd recommend you do a comprehensive stool analysis from doctor's data or from Genova Diagnostics or a company like that to see what's really going on in terms of, looking at your gut from a functional perspective. Because remember, medical practitioners don't so much are not so interested in the function. They're more interested in the pathology, the histopathology, or looking at the very small cells, looking for bacteria, looking for causes, through that infectious route. Sometimes it works, sometimes it doesn't work. But by getting a comprehensive test, you're going to get a fuller picture. Now, you talk here about, I've had pain, which I thought was my liver, and toxicity feeling. So the very first thing I would do in that case would be look very carefully what you're eating and drinking, and to maybe make some changes there, all right? But the stool test will give you a lot better understanding of what's going on there. So pain, I'm not sure where the pain's coming from. It could be on the left quadrant or the right quadrant. So the quadrants are quite important areas here, sort of, on these on the outlying parts of the bowel there. We commonly see people with issues also around the ileocecal valve here on the right side. So that connects the small and large intestine together. There's a one-way valve in there, so stool can go through but not back. Now, I've many times found when I've examined patients, when I touch the ileocecal valve, it's a hot spot. So the patient starts to guard it, or they say, oh, that's tender, or it shouldn't be tender. Right? If it's on the left side, it's more likely to be diverticulitis, all right, little bowel pocket that can be formed. And this is very common in people in the Western world who sit on lavatories, who try and evacuate their bowels too quick, who force stool through there, they don't relax, they're not drinking enough fluid, they're eating too many foods that block them up or constipate them, they eat a lot of meat, they don't drink water, drink alcohol a lot. These people commonly get diverticulitis, and that can certainly give you a flu-y sensation. Elevated temperature, there can be like little darting pains here, like, oh, you might get that early in the morning or late at night. There could be, different times you get it. But diverticulitis is very common. But what you'll find is the gastroenterologist will pick up very quick if it's that. But if it's the ileocecal valve and the pain or tenderness around there, often it's not picked up. And I find that to be bacterial or fungal in many cases. A stool test will reveal all, right? That will show. And then you can start looking more carefully at a natural treatment to get rid of this smouldering kind of pain. Because remember, okay, the liver is on the right side, and it's right there, just under where that valve, okay, or it's above where that valve is. So many people commonly mistake that as a liver pain. If you've got liver issues, that'll soon be picked up with a blood test or a proper clinical examination as well. So I hope that answers some of the question. Thanks for tuning in.